So now we are going to discuss about the medical management of chronic stable angina. Now the coronary artery disease classification has been modified into acute coronary syndrome, which we have seen the pathophysiology as well as the STEMI management, non-STEMI management. This all come under acute coronary syndrome. Now they have divided this chronic coronary artery disease into chronic coronary syndrome. So chronic coronary syndrome are those patients who got chronic coronary artery disease. They may have a post-MI, they may have a post-PCI or post-CABG, or they may be symptomatic or asymptomatic. Especially the chronic symptoms like chronic stable angina, previously used to call as a chronic stable angina. But the better terminology is a demand angina. Why we call this a demand angina is, this angina will happen whenever myocardial oxygen demand exceeds myocardial oxygen supply. So that's why it is called demand angina. So previous term, the older terminology is chronic stable angina. So what we are going to see is the management of chronic coronary syndrome. So we already seen that we are the world leaders of coronary heart disease. Mortality is very high, and by the time we finish this talk, 90 people would have died of cardiovascular disease in India. So that is the important thing about coronary heart disease. So first we have to understand, this is a roadmap of my talk today. So why medical therapy? Why not we do all patients PCI or bypass surgery, especially in India? Then we have to understand coronary heart disease, which we have done in our previous segment, medical management, how to optimize and take away messages. So why should we bother about medical management in India is because we have a growing epidemic of non-communicable diseases. In non-communicable diseases, especially ischemic heart disease is the number one killer for many years in India. Ischemic heart disease is the number one killer in India also. And what is very important for this treatment of this very chronic and very dangerous disease, the patient has to spend money from his pocket for all his treatment. Whether he undergoes a PCI or a bypass surgery, or he has to take treatment, he has to spend a lot of money. So as far as the guidelines are concerned, we always depend upon the international guideline to treat a STEMI or non-STEMI or a chronic coronary syndrome. Many times these international guidelines may not be applicable to our patients because of the cost of the therapy, compliance of our patients, as well as the mindset of our patients.